Hello, I'm Dr. Daniel Farkas, and I'm here to talk to you today about cardiac rejuvenation. Would you like to help yourself? Good news, people are getting help. Natural health care helps lots of people. I want you to take a second and think about your future. And what will it look like if you keep doing things the way that you're doing them? What is your plan to get away from the drugs? And also, what will happen if you maintain the same course? Well, what must be done? We must assess deficiencies and toxicities that cause the problem with precision laboratory testing. And we must use those values to create a long-term plan to reverse what caused them, with the focus being on the cause. Now, ordinary tests and treatment, medical tests determine what drug to put you on typically. And good medicine practices and protocols come from drug manufacturers who are interested in profit. Drugs just seem to treat symptoms, but unfortunately all drugs have side effects. Oftentimes we get stuck with more drugs and no solutions. Good news though, there are special tests that can help discover some of the things that cause and add to cardiovascular disease. We can test now for metals. We can measure the blood levels and the ability of the body to detoxify from these metals and determine if it needs help. We can also measure the small intestine and its function. The purpose of the small intestine is to keep inflammatory particles out of your body and out of your blood. We can also use an exciting new approach of genetics, where we can map the DNA and find weaknesses in the genetic code and support it where it needs. We can also check for infections. Dormant bacteria and active bacteria can add to cardiovascular disease. Also, knowing allergens that cause inflammation is critical. Testing for micronutrients that the body can become deficient in is very important. Long-term drug use and long-term disease often cause our body to become deficient in very, very crucial micronutrients. It's also a great idea to test for inflammatory blood markers. Things like C-reactive protein, homocysteine, and fibrinogen can tell us what the present level of inflammation is in the body, and later can be retested in order to determine if things are working. Lipofractions, very important. These determine the blood particle size and viscosity, and we can always use post-testing to demonstrate efficacy. It's just what you think. You can help yourself. You just need to know what is causing your condition. Take action. Cardiac disease can worsen with time. Look below for information about getting help now.